Hi everybody, I'm here to talk with you about sleep, and I'm going to make this as short and sweet as I can, but I want to make sure that I get you all the details about how to get a good night's sleep and also how vital it is to your health. Most people think, oh, I don't want to walk around tired and dragging in big bags under my eyes, right? But the bigger picture is that it can dramatically affect your health overall. Not only just how long you live, but the quality of life that you have. So I'm going to give you some tips, some things that you can do right now that will absolutely dramatically improve the quality of your sleep. There are about 70 million people in the US that suffer with some sort of sleep disorder. That can be from snoring to insomnia to sleep apnea, which I'll get into a little bit later about what that means. But you're not alone. The body works in patterns, right? We have all sorts of cycles. We have the circadian rhythm that our bodies operate on, which controls our digestive cycle. It controls if you're a woman, it controls our reproductive cycle. We also have sleep cycles, and everything in the body has to work properly for us to have optimal health. So having a normal sleep cycle means that the majority of the time you're sleeping really, really well. So when I get patients that come in and say, okay, well, a couple nights a week, I don't sleep well. Well, how long has that been going on? Oh, 20 years. Okay, that's not normal. It's not normal. You should have regular patterns of sleeping well through the night all the time. That's what's normal. So we want to make sure that we're calling a thing a thing. We don't want to just say, oh, it's not that bad, or I kind of don't sleep well sometimes. You should be sleeping from the time you go to sleep until you wake up. Okay, that's what sleeping is, undisturbed. So how can you prepare yourself? There are a few things I want to go through in terms of risk factors. And before we get into what you can do to have yourself sleep better is what happens when you have a few nights of bad sleep and what happens if you have a long-standing pattern of bad sleep. They're very different. So a few nights, it will actually change, of course, your appearance, right? You may be more bags under your eyes, dark, you don't look as approachable and as friendly. You may also notice a change in your appetite. Good sleep, actually, there's a hormone called ghrelin that is released when we have good sleep, or that is at optimal levels, and it controls our hunger. So if you're not getting good sleep, it can actually make you more hungry, okay? Your immunity goes down. You're more likely to catch a cold. We're also, in fact, losing brain tissue. I don't know about you, but I got enough and just barely enough, so I don't want to accelerate the loss of brain tissue in any way. We can be less focused. We can have memory problems. All of those things happen with a few nights of bad sleep. But what happens when we have a long-standing pattern of bad sleep? Unfortunately, our stroke risk quadruples. 4 times. 1, 2, 3, 4. Quadruples, okay? So stroke is one of those things, yes, we're all going to die from something, but we want to mitigate our risk factors for the things that are big disablers. Stroke and diabetes, we want to avoid those at all costs, right? So quadruples our stroke risk. The risk of some cancers also increase. So why is this? I'll get into in a minute, but breast cancer up by 3 times, colorectal cancer up by 4 times. Okay, again, quadrupling and tripling our risk of certain cancers with not enough sleep. We need that downtime. Our immune system needs the downtime to be able to seek out and destroy all those cells that are abnormally functioning. So if we are not hitting those deep states of rest and those deep levels of sleep, our immune system is not capable of seeking out and destroying those cancerous cells. So we have to make sure for our cancer risk that we get enough sleep. Heart disease risk goes up. Makes sense, right? Our heart cannot fully relax. It doesn't drop into that deep restful state. Our heart is the muscle that has to work all the time. So our heart disease risk starts to go way up when we don't have enough sleep. Sperm count decreases. Yes, this is important if you're in reproductive years, but what is actually an indicator of is our decrease in human growth hormone production. So even beyond reproductive years, we want to have our human growth hormone, which is our repair hormone. What repairs our body? It tells our body to repair. So we definitely want our growth hormone levels to stay elevated and up. Okay, and of course, risk of death goes way up. So I want to give you some practical things that you can do to tackle your insomnia, and 3 of them you're going to be able to do yourself, and 1 you're going to need some help with. First one is environmental. Have to set up your room for success. This means dim lights. This means dark rooms, blackout shades if you need to. Any source of ambient light is going to disturb your sleep function. When you have light in the middle of the night, it actually turns on parts of your brain. That means if you go to the bathroom, leave the lights off. Heaven forbid, don't go to the fridge, okay? No opening the fridge in the middle of the night. That's the worst thing that you could possibly do. Don't do that. So, no lights on. It also means no cell phones. None of those mini screens beside your face, okay? That blue light actually does trigger certain parts of our brain to wake up, and we don't want that. So environment, set up your environment. They actually recommend, and I recommend, no screens for an hour before bed. So 1 whole hour. You can do it. You can do it. 1 hour. No TV. Pick up a book. Read something, right? No phones. No screens. Behavioral is the second category. So environment is the first one, behavior is the second one. We want to prepare our bodies for rest. We want to prepare our minds for rest. So exercise is awesome, but you need to do it at least 5 hours before bed, especially if you're having problems with sleep. So 5 hours before bed means if you go to bed at 10, you need to exercise before 5. How long should you sleep, by the way? How many hours are recommended? Yes, 7 to 8 for adults. Not everybody needs 8, but we need at least 7 to 8. I'm good on 8, I'm good on 9 even. 9 is even better. But if you can get 8, awesome. Okay, so behavioral, exercise before bed, not a good thing. We want to exercise early in the day, middle of the day, but not 5 hours before bed. Second thing with behavior, heavy meals, heavy carb-laden meals, refined carbs, I'm talking about plates of pasta, etc., will often have you fall asleep quickly, but your quality of sleep is diminished when we have a lot of heavy carbs late at night. How about the voice that you talk to yourself with? I know you have one because I have one. Everybody has that voice they talk to themselves with, right? So, in our heads during the day, this is what the CEO voice sounds like. Get up, check your email, make those phone calls, get the kids to school, get to your appointment, blah, 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 right? That voice. That voice doesn't help us sleep, doesn't help us relax. So what we want to do is find a way to talk to yourself quietly. Use that soft voice and a slow voice, even inside your head before bed, okay? That will help shift your state into a more relaxed state, and that's what we want. Meditation apps are really great as well. So if you can find one on the iTunes store, there's quite a few that I like, but find one 5 to 10 minutes before bed can really set the tone for a great night's sleep, okay? The last one has something to do with obstructive sleep apnea, and this is actually the one that where you're going to need some help with this one. So if this is something that you're suffering with, you may know it because your spouse or loved one might tell you that you don't breathe in the middle of the night, or you take pauses in your breath. Again, not good, right? We want constant flow of oxygen. That's really good for us. So obstructive sleep apnea, there's two kinds of sleep apnea that I'll go through. One is a primary or neurologic, and again, once or twice a year I might see one of these in my office, and that's a direct referral to a neurologist. That's where the brain is actually not sending the proper signal to breathe, and that's an immediate referral. But obstructive sleep apnea has to do when the muscles of the throat relax and they slide back, and so the structure is off in the neck. And when the structure is off in the neck, it will actually force muscles to relax, tongue slides back, things get choked in there, and then we stop breathing. So this is actually where we can really help. So if somebody has obstructive sleep apnea and has never been evaluated by a chiropractor, that is one of the best things to do. That's what we work with, the structure of the neck, getting things aligned properly and functioning properly so that you don't have to suffer these effects of sleep apnea. And they are quite devastating. Again, increased risk of diabetes, increased risk of stroke, increased risk of heart disease, cancer, all those 4 major debilitators and killers that we can dramatically influence by getting proper sleep. You know, the thing I always think of when people have a problem, they want a quick solution, they often turn to medication. And this is one of the scariest components of not having good sleep, of these certain medications. They have some crazy side effects, okay? insane. I doubt you've heard of them before. You let me know if you have, because I'd never heard of them before I started to do this research. But according to the FDA, some of the warnings on these boxes or these inserts for sleep medication, you know, the ones with the purple butterfly, and the purple butterfly comes and just rests on your shoulder and you drift off to sleep. You know, that never happens, right? But anyways, some of those side effects are things like abnormal thinking, strange behavior. How about this one? Sleep eating. Sleep eating. I don't know about you, but most people do not want to be comatose and in the fridge preparing a Thanksgiving meal because of a side effect, right? Who wants that? So sleep eating, not good. Sleep driving. This is even more scary, right? Sleep driving. There have been reports of moms, and they have them on the red light cameras, where they've seen moms, kids in the back seat, they get them up, they put them in the car, and they drive right through red lights, okay, and don't remember a thing. So these drugs are nothing to mess with. Nothing to mess with when it comes to getting better sleep. Never mind the other side effects, dry mouth and diarrhea and erectile dysfunction and blah, 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 right? You name it. You name it, it's a side effect. So we always want to be able to help people when we can do something, and we know we can. And in fact, about 85% of our practice reports sleeping better when they're under care. So we know that we can help, and I hope that this video has given you a little insight both into the problems that happen when we don't get good sleep, and also some tips to really help set up your environment, your behavior before bed, and some other things you can do for relaxation so that you can get back to getting a really good night's sleep. Okay, I hope this helped. If you have any questions, please do let me know in office. Me or Dr. Steph, we're happy to help you out and get you back on track and sleeping well. Thanks.